Good morning. It is Wednesday, October 15th. I'm Lauren Prismal.
And I'm Tim Ryan. Another Dallas healthcare worker who treated Thomas Duncan is diagnosed with that virus.
City and county leaders are getting ready to update us on that situation. Jenny and Chondo live at Dallas County Commissioner's Court with the very latest. Jenny?
That's right. You know, we're waiting for Dallas County Judge Clay Jenkins. We're waiting for Mayor Rawlings. We're also waiting for a healthcare authority, really, who has been here throughout the entire time, Dr. Vargas, to explain what has happened with this second case. Meantime, they are walking in. We're just waiting for them to speak. As we're waiting, we'll go to Sky 4 and show you the area we're speaking about right now. This is the Village Bend Apartments. It's right at Skillman and Village Bend near Lovers in Northeast Dallas. So right now, flyers are being handed out in English and in Spanish, and it looks like Clay Jenkins is about to speak right now.
Next few minutes. Like Nina Pham, this is a heroic person. I'm sorry, I said like Nina Pham, this is a heroic person, a person who dedicated her life and is dedicating her life to helping others and is a servant leader. This is a person with their life before them and a person who is dealing with this diagnosis with the grit and grace and determination that Nina has dealt with the diagnosis. And like Nina, the protocol to find the virus worked well in that within 90 minutes of her temperature, of taking her temperature, she was in isolation in the hospital. And we hope that and pray that, like Nina, she will get on a good track. As you know, Nina has moved from stable to good, and the doctor may have some information on her health when he speaks this morning. So the fight against Ebola in Dallas is a two-front fight now. We have 48 disease contacts that we focused on in the community that were contacts with Eric Duncan. The good news about those 48 people is they are asymptomatic and have no fever, and we are at the tail end of their monitoring period. Sunday will mark the end of that monitoring period, and the chance of those people becoming symptomatic at this point or getting the Ebola virus is extremely remote. However, at the hospital, we have a situation involving 77 people, 2 of which have tested positive for Ebola. We are preparing contingencies for more, and that is a very real possibility. You can imagine the anxiety of the families of these 77 people. You can imagine the gut shot that this is to the family that is Presbyterian, a hospital that has done a great job of taking care of this community for many, many years. I hope this community will rally around the human beings that are suffering and worrying now, even as they go about their calling of serving others. With me today is Dr. Varga, the Executive Vice President of Texas Health Presbyterian, who will speak next. Mayor Mike Rawlings will speak after Dr. Varga, and we'll take some very limited questions after that time. We're giving you the very limited information that we have at present. We are continuing to get information, and we'll be updating you throughout the day in a variety of ways. And we have some very important work that I need to get to quick, the mayor and I need to get to at the conclusion of this. So, Dr. Varga.
Excuse me. Thank you, Judge Jenkins. Good morning. My name is Dr. Daniel Varga. I'm the Chief Clinical Officer for Texas Health Resources. And I want to thank the mayor, the judge, the CDC, state health officials, and the Dallas County Health Department for their continued partnership as we manage this unprecedented crisis. As others have said this morning, today's development, while concerning and unfortunate, is continued evidence that our monitoring program is working. Currently, as Judge Jenkins says, we continue to monitor 75 healthcare workers in conjunction with the state. And while I cannot discuss patient specifics, I can tell you this new patient was involved in the care of Mr. Duncan, the original patient whose passing we still mourn. Our interest at this time, first and foremost, is making certain that both our current patients receive the care they need. That will remain our focus. The health and safety of our patients and employees remains our highest priority, and we will continue to coordinate with officials at all levels to meet the challenge that Ebola presents to our hospital, our community, and our country. A lot is being said about what may or may not have occurred to cause some of our colleagues to contract this disease, but it's clear there was an exposure somewhere, sometime in their treatment of Mr. Duncan. Let's be clear, we're a hospital that serves this community incredibly well, and we have for nearly a half a century. We're a hospital that may have done some things different with the benefit of what we know today, but makes no mistake, no one wants to get this right more than our hospital, the first to diagnose and treat this insidious disease that's now attacked two of our own. After several weeks of great emotion and great effort, our team's spirit is tried and tested, and the support of so many is really helping everyone to rise to continue to meet this challenge. Thank you.
Well, good morning. Another long evening and morning for many, many people. We rallied together and we decided that we needed to move quickly like we did Sunday morning to make sure two things happen. One, that effective cleaning was done as soon as possible, and two, neighbors and the citizens were communicated. It is no odd thing that we decided to do this at 7 o'clock in the morning, so when folks are getting up, they know what the facts are. It is a concerted effort, not only with the county and the state and the city, but individuals out there. This morning, Chief Brown, Chief Bright, our city manager, were all working in coordination to accomplish our goals for this morning. Dallas Fire and Rescue went to the 6,000 block of Village Bend Drive, where they began phase 1 of decontamination of the common areas and the areas outside the apartment. Our patient lived alone and with no pets. State of Texas has hired Protect Environmental for phase 2, that inside the apartment and the cleaning of the car and the movement of the same, removing the same. That hopefully will be done early this afternoon. I personally was at the apartment complex this morning and talked to citizens as they were waking up and moving about, which leads us to the second part of our strategy, communication. We worked closely with the apartment managers in creating a strategy that I think is working. Each apartment in their complex the door was knocked on, and we talked to as many people that came to the door as possible. Same time, the apartment complex will be handing out flyers and information to apartment complexes nearby. So we cast the net a little wider. And then we had reverse 911 calls that went out at 6:15 this morning. Meanwhile, we continued to not only monitor the 48 individuals that came in contact with Mr. Duncan, but we take care of Louise and her family who are still in isolation. They are asymptomatic, and they are doing well. And as you know, we moved Nina's pet yesterday, and are making sure that that pet is well and taken care of at the same time. I think there are two things that I hearken back to this. The only way that we are going to beat this is person by person, moment by moment, detail by detail. We have those protocols in place, the city and county, working closely with the CDC and the hospital. The second is we want to minimize rumors and maximize facts. We want to deal with facts, not fear. And I continue to believe that while Dallas is anxious about this, and with this news this morning, the anxiety level goes up a level, we are not fearful. And I'm pleased and proud of the citizens that I talk to day in and day out, knowing that there is hope if we take care and do what is right in these details. It may get worse before it gets better, but it will get better. With that, we will take a few questions, all right? And, but there are a lot of questions we can't answer because either we don't know or because testimony and discussion is going to take place later this week. But we will try to give it a go and give you as much information as we can. We'll start on this side. Go ahead and we'll take a couple questions here and then we'll move to that side. Yes, sir.
Hi, this is for Dr. Varga, Kevin Sack with the New York Times. Dr. Varga, talk a little bit about the hospital's view of how this is happening now. I mean, obviously, we're all empathetic with what you guys are going through, but one case can be looked at as, you know, a possible breach. It seems like a second case might suggest some sort of systematic institutional problem. Do you think so?
I don't think we have a systematic institutional problem. I think the biggest challenge we have right now is obviously first and foremost the care of the two patients that we have and the ongoing screening of folks in the community. Our emergency department has continued to have folks come in. It's a tribute to the information that's been out there in the community about folks to be aware of this symptomatology around Ebola. Our ED's been handling folks through that very appropriately. I think the case of this patient here tonight again shows that the ability to intake those folks, get them into isolation and manage them has been very effective. But we're looking at every element of our personal protective equipment and infection control inside the hospitals. We don't have an answer for this right now, but we're looking at every possible angle around this.
Thank you. Right down here, you raise your hand.
Was this person a nurse?
That is private information. It was part of the health care group that helped.
It is a woman.
She is a woman.
Yeah. Over here, and then we'll come back. Just go ahead.
Are you awaiting test results on any other employees? Because obviously this one was in the works yesterday during the other press release.
That is that's the state's decision, and I'll let them speak to that. Later today, there will be a discussion. There will be a joint conference call as normal with the CDC and the state.
About this case or about another case?
About this case.
Yeah, and let me. I'm not sure what briefing you're referring to, which was at 1 o'clock in the afternoon. 2 o'clock. So there was no test, as far as I know, that was pending at 2 o'clock yesterday.
When did the person come forward?
I don't have the medical records. You know, I've been up all night, but I don't believe there was a blood draw then.
So we can't speak about any of the about any of the details of the patient's case, presentation, et cetera, because it's protected health information at this time. So I'll have to leave it at that.
So, Dr. Varga,
Okay, right here on the end.
The hospital was very transparent with employees saying that 2 staff members were admitted to the hospital and
Pardon me, could you repeat that?
The hospital told employees that there were 2 staff members that had been admitted a couple of days ago and were being checked out. Was this one of those 2?
No.
Thank you. One.
And follow-up question, there's 3 isolation rooms at the hospital from what I understand. What's going to happen when there's more patients?
You want me to take that last part?
Sure.
That's something that's one of the reasons why we'll be leaving here pretty soon. That's something that the CDC and the state public health commissioner and our EOC are looking at along with the hospital, and the CDC will and the hospital will answer those questions later after the data is looked at.
But let me just speak to your capacity question. We have at Presbyterian an emergency room isolation setup. We have an ICU isolation setup where we've let folks in the community know we can manage up to 3 patients. We've also opened a new area within the hospital to expand our capacity for ED screening, and I would emphasize that our biggest focus, in addition to the care of these 2 patients that are in the hospital, is trying to keep our arms around the number of folks who come into the emergency department with concerns about whether or not they've been in contact with folks, et cetera, and then rapidly getting through a screening process for those folks.
2 questions, right here, and then I'll come over here.
Can someone just give us a sense of the timeline overnight of what happened when the results came through, and then when the Dallas police went out, sort of the timeline of that?
So I got confirmation at about 1 o'clock. Judge Jenkins had gone up to the hospital. I got in the car, went up and met with him. We met with our city individuals and planned this out. The press, we knew that the press release was going to be happening at 4, so all the police and the fire were there before that. Once the press release happened, we implemented the plans, and they've been working this morning. Okay, thank you. And there was, you've already asked one right there.
Dr. Barger, there's been some strong allegations about not proper protective gear for the nurses. Your comments on that? Can you handle it on the case? You have the equipment you need.
I can't comment on any kind of allegations.
You said you have them. Do they have the proper protective gear?
We do.
The question now is,
Okay.
are other hospital
Thank you.
workers being isolated either at their homes or at the hospital? Because if we have 2 that came down with symptoms very early on, are steps being made that they are isolated now?
And are they still working?
Yeah, let me
And that'll be our last comment.
that's going to be our last comment. We need your help on this. We have 75 people who are hospital workers, and we don't want a situation where people are afraid that if they bump into an asymptomatic person who works at a hospital and has been involved in the care of Mr. Duncan at the Kroger's, that they've been exposed to Ebola. Because what this case further illustrates, these 2 heroic women's plight illustrates, is Ebola comes from the body fluids of a symptomatic Ebola victim. And that's how they contracted the disease, and that's how Eric Duncan contracted the disease. You don't contract the disease from being around asymptomatic people. They are regularly testing their temperatures. We are going to set up a place where if people want to be away from their family, they have the opportunity to do so. Or if, like Nina, they live alone with their dog and they choose to be monitored there, they can do that. This is not going to be a situation where we're going to put protective orders on 75 healthcare workers. The system right now is working. They are taking their temperature regularly. If they have a slight headache, a slight fever, if they get a chill because the breeze blows, they take their temperature. If they have any temperature or any other, loose stool or any other symptom, they immediately go to isolation in the hospital, and they are tested. And what's that? No, they are not they are employed but not working.
Thank you, guys. That's it. Appreciate it.
All right, that news conference just wrapping up. Basically, we learned that it's a female healthcare worker. I think there was some confusion this morning, but it's a female healthcare worker. This patient lived alone. These are live pictures from Sky 4 over the apartment.
Right.
The big thing I think came out of it was Clay Jenkins saying, we're preparing contingencies for more cases. That's a real possibility. And the mayor's saying it may get worse before it gets better.
Right. Right, which is really shocking. This is the apartment complex called The Village. A sprawling bunch of apartment complexes not terribly far away from Presbyterian Hospital, where that healthcare worker lives and is being decontaminated, going door to door as they described. We will be back with more after a short break.